Let's talk vital signs. Today, this is going to include heart rate, respiratory rate, and pulse oximetry. Following the instructional video, the viewer will be able to be efficient in the definition of vital signs and understand the importance of vital signs in the healthcare field, to identify and measure vital signs accurately in a timely manner, effectively interpret vital sign measurements, to appropriately monitor the patient, recognize abnormal vital signs and common causes in regard to the acceptable values, apply their knowledge of vital signs to real-life situations to productively observe patients. So what are vital signs? Vital signs are used to measure the body's basic functions and assess the general physical health of a person. Typically, this includes heart rate, respiratory rate, temperature, blood pressure, and oxygen saturation. For these purposes, we will just be talking about the three mentioned earlier. Let's begin with heart rate. This is the number of times your heart beats per minute. A normal heart rate is 60 to 100 beats per minute. A slow heart rate is bradycardia, which is less than 60 beats per minute. A fast heart rate is called tachycardia and is more than 100 beats per minute. A person's heart rate varies person to person. This is because your body has different needs. Pulse strength may also vary, as blood pressures vary person to person as well. Your heart rate will be lower when you're resting and faster when you are exercising. Now, let's talk about respiratory rate. Normal respiratory rate is between 12 and 20 breaths per minute. A slow respiratory rate is indicated by less than 12 breaths per minute and is called bradypnea. A fast respiratory rate is indicated by more than 20 breaths per minute and is called tachypnea. When a person is having trouble breathing or painful breathing, you may hear this called dyspnea. Lastly, we have oxygen saturation measured by pulse oximetry. A pulse oximeter is used to measure a person's SpO2, which is the saturation of peripheral oxygen. The normal range is 93 to 100%. Below 93% indicates hypoxia. The first step in taking vital signs is reviewing the chart for significant findings. Here you can find if the patient has an underlying pathology that would relate to an abnormal vital sign, or if the patient usually has normal or abnormal vital signs. Next, you will prep by gathering your equipment. For this, you will be needing a pulse oximeter, a finger probe depending on the machine, paper and pen, a clock, and gloves. Here I am showing the equipment I gathered for my demonstration. Before any patient interaction, you should always be having proper hand hygiene. This includes a 15-second hand wash. For demonstration purposes, I have sped up my hand hygiene. Along with hand hygiene, you should always put on a pair of gloves before interacting with the patient. As you walk into a patient's room, you should always introduce yourself to the patient by stating your name and your department. This is also when you should ask the patient for their name and date of birth. Hi, my name is Emily. I'm from respiratory. Can I have your name and date of birth? Next, you will explain what you're doing and what the purpose of it is. I'm going to be taking your vitals today in order to appropriately monitor your physical health. This will include your heart rate, your respiratory rate, and your oxygen saturation. Do you have any questions? To measure the heart rate, you should be using your index and middle fingers for 1 minute in your desired location, radial or brachial. Here I am showing you the brachial site, and here I am showing you the radial site, which you can see is along the thumb side of the hand. Using your index and middle finger, palpate the site of your choice and measure for 1 minute.
One minute later.
At the end of my 1 minute, I counted 60 beats. Next, we will measure the respiratory rate for 1 minute. Here, you will watch the rise and fall of the chest for 1 minute, as one rise and fall equals one breath. If you are having trouble counting the respirations, you can cross the patient's arm across their chest to get a better feel for the respirations. We will assess oxygen saturation using a pulse oximeter. This includes assembling the device, assessing proper location and perfusion, proper placement of the probe, proper alarm settings, and validating results. By setting proper alarms, you will be alerted if the patient's vital signs differ for any reason. Here I am setting the SpO2 at 88 as a low and leaving the heart rate as it is per hospital protocol. For my probe placement, I chose the finger, but you may also see the ear. To assess adequate perfusion, you can use the capillary refill test. Proper placement of the probe is crucial in order to get an accurate reading. As you can see, I am placing the red light on top of the fingernail and wrapping the sticky sides around the finger. This is to ensure that the probe will not move. You can also place a piece of tape on the probe wire if it happens to catch loose or catch onto something. To check proper function, you can compare the heart rate that you had gotten and compare it to the pulse that is received on the pulse oximeter. Once you have gotten your results, you can validate these in relation to patient condition. As always, before you leave the room, you should decontaminate your hands by using hand sanitizer or a 15-second hand wash. One of the most important skills to have is to assess the patient prior, during, and after taking their vital signs. How the patient is presenting can tell you so much more than any number can. Proper bedside manner is key to maintaining trust with your patients. This is when you take time to listen and explain. You be aware of your body language, use common courtesy, be empathetic, ensure privacy, focus on the patient, and never judge. Many things can cause an abnormal heart rate. Bradycardia can be caused by medications, hypothermia, and drug use. Tachycardia can be caused by exercise, caffeine, stress, infection, and anxiety. Like heart rate, many things can affect a respiratory rate. Bradypnea is caused by lung disease and substance abuse. Tachypnea is caused by pneumonia, anxiety, lung disease, and more. The two factors that affect an abnormal oxygen saturation are inaccuracy and hypoxia. Inaccuracy includes low perfusion to extremities and nail polish, while hypoxia includes lung disease, anemia, sleep apnea, and many more. Thanks for watching. Now let's go take some vital signs.